All right, if you're a beginner runner and whether your goal is to finish your first event, lose weight, or simply get your fitness improved, this video is for you. We are honored to have Dr. Jake Hegge here. He is a physical therapist and a running coach, and he is really the one to get some expert information and opinions.
Well, thanks for having me. Excited to be here. I've obviously been a huge fan of the show for years, and we even go way back. You were kind of like my mentor back when I was in PT
Oh,
school.
I don't know about
Back when
that.
that's kind of how we originally met. So here we are today.
All right.
So I'm a physical therapist down in La Crosse, Wisconsin. Work at a private practice. Primarily work with athletes. Usually, obviously, the running side of things. So anything hip and below is kind of my specialty. Also have a coaching business called Trail Transformation, where I work with athletes all over the U.S. to help them basically reach their running goals. And it was kind of a spin-off from the PT side of things, where typically we see people in the clinic, rehab them, get them on their way, get them out the door, hey, let's start running again. But the biggest issue with running injuries is usually doing too much too soon. So we were looking for a way, how do we transition from the rehab side of things back into the performance side of things? So
So, JP, I don't want to interrupt, but I want to.
yes, of course.
We talked about athletes. Now, I know because I know one person in particular. He's 60 years old, 61 or 62 now. Never ran a day in his life, and he decided to run a half marathon. He did actually do it, but he needed your help because he had knee problems. So you don't just coach strictly athletes. You do coach people, lay people,
Oh,
how
yes.
beginner runners.
All levels.
Okay.
Yep.
Good.
Yeah. And that individual in particular is super interesting. He had some meniscus problems. The doctor actually said he should never run again. But he wanted to keep going. And it was like, hey, as long as we can manage this thing, manage your symptoms, increase training load progressively, get on a good mobility and strength routine. Yeah. And he's been crushing it ever since. He's still running half marathons.
He
And
just ran one in California.
yes, he did. Yep.
So, very good. Why don't we talk about maybe in order? We got three things, but we may talk a little bit further. Common reasons why people come to you, whether it's because they're a beginner runner, or they want to increase their speed, or
Yep.
they want to run without nagging injuries.
Yeah, so the biggest thing to kind of avoid the injury side of things is the whole progression. So the number one reason, like I said, for injuries early on is doing too much too soon. They're increasing their volume or increasing their speed too quickly. So for a beginner, I would say the best thing you can do is start with a simple run walk program. It might be running for 30 seconds and then walking for a minute. It might be even, running for 2 minutes and walking for 3 minutes, but that slow schedule, gradual increase of running duration. And after you get, maybe 5 minutes of, continuous running and a couple minutes of walking, then you can start doing more of the, maybe you run a full mile nonstop. But the biggest reason for injury is doing too much too soon.
Sure. Now, if you start with a beginner runner, and you're doing it not in person, but you're doing it Zoom or whatever online, how do you assess them? And then you will give them, well, let's start at 30 seconds or running for 5 minutes first. You'll kind of come up with some way that it's safe to.
Yeah, so that's where it ultimately comes down to communication, what their baseline is, what their current, fitness levels, their experience, and ultimately their future goals too. So it might be, hey, maybe a minute is too far or too long for
Yeah.
right now, and they're just getting out of breath. So maybe we have to bump it down to, 30 seconds. But gradually over time, the unique thing with the human body is it gets stronger,
Sure.
right? It's that progressive load.
And now I would want to say, I bet you this is one of your biggest problems is if it was me going to you, I would be like, I want to run 30, 3 minutes.
Yes.
I'm doing a 5K run. I would want to run at least 2 miles the first day.
Yeah.
And I'd get sore feet, probably
Exactly.
Achilles tendonitis or something like that. So that must be a challenge.
It is, yep. A lot of people just want to go for it out of the gates, but it's, thinking big picture, how do we safely increase that volume
Sure.
and ultimately feel good while doing it, right? If you were to go for 2 miles out of the gates, chances are you're like huffing and puffing, all the muscles are sore. You want to be able to increase things sustainably and feel good while doing it.
Right, right. What's the second thing?
Second thing, shoes. Shoes are very, very important. I actually used to work in a running store down in La Crosse, and obviously,
I remember that store.
Yep, Grand Bluff Running. Actually, where I started the PT practice in a kind of back room. It was basically a closet, but that's where it all got started. So, yeah, shoes are the biggest thing. There's so much out there. Structured, minimalist, zero drop. Wide toe box. All of those kind of different variations or
Sure.
fads that are out there, but ultimately it comes down to comfort is king. The shoe should feel kind of snug on the foot. My big three things when telling someone to look into a shoe is the heel. Does it feel nice and snug? The arch, does it feel supportive, but obviously not, overdoing it where it's pushing your foot laterally? And then the other one is the toe box. So making sure that you have at least a thumbnail. Those are a little too big for you there. Look at that, even wearing at the toe
I
box.
only wear these on video. Can you imagine? I'm even wearing that, and I've never done anything but walk from there to here.
Okay,
with
fair
them.
enough, fair enough. But yes, typically one thumbnail between the edge of the
Oh.
shoe and your longest toe. Some people that's the big toe, some people it's the second toe.
So the width of the shoe in the toe box area. So we're talking here.
Yep.
I'm under the understanding that if it's too tight, you've got you're going to cause problems.
Yes.
Is that
Agreed.
Okay.
So it's interesting you bring that up, though. I actually just had a patient about 2 weeks ago. He kept running into this issue of his forefoot feeling so tight, and
Yeah.
he was even going in wider shoes. And I bring out the Brannick device, which is how you measure basically shoe length or shoe size, and I throw him on it, and he's been wearing like 12s, and I throw him on that, and it says 10 and a half.
Oh.
And I'm like, you've been wearing a size and a half too big, and so you could actually see the pivot point, basically the break point of the shoe was totally off. So where his widest part of the foot was actually in the narrow section.
Okay.
So obviously shoe fitting is also very important. But yeah, the heel nice and snug, arch is it supported, and toes is there enough wiggle room. The big other thing too is, are the shoes updated? So I'll typically have people just do a simple break test. If you push on both ends of the shoe, does it bend in the middle? And obviously I just wear these around the clinic so they don't have a lot of wear and tear on them. But typically in shoes that are really worn, you would see a really big break here in the forefoot, meaning that some of the cushion is gone and you probably are due for a new pair.
Sure. Yeah, I mean that shoe question. I think so many people are wondering: am I wearing the right shoe? My, things are hurting. The shoe, improper footwear, maybe can cause problems in the knee,
Yep.
in the hip, or even the back. So obviously, well, should we go on to the third?
Let's
third
do it.
Point?
Let's do it. So the last one is just the thing that people or PTs specialize in, the mobility and stability side of things.
So mobility, we're running. What do you mean mobility? We know we're going to run.
Yes, but making sure you have enough movement in the joints and the muscles, the hips, knees, ankles, to to make sure that you're not just overcompensating with other muscles.
So
in the chain.
flexibility, muscles are tight, maybe not allowing your knee to rotate that little
Or
screw
get
home
that
mechanism,
exactly,
whatever.
or
Yeah.
extension, and the stability is the actual control of that mobility
Sure.
of the joints and the muscles. So if I were to pick one specific area to focus on for beginners, goes back to one of our favorite movies, Happy Gilmore. Remember what Chubbs tells Happy when he's teaching him how to putt?
For those you don't know, this is what's his name? Adam Sandler
Yes,
golfing
yes.
thing. Anyways, what does he say?
He says it's all in the hips. So the biggest thing is making sure that the hips are mobile and also stable. So one of the most important ranges of motion with running is hip flexion as well as hip extension. And the biggest thing that we see a lot of with just posture throughout the day is our hips are kind of in that forward contracted position, making sure that when we're running, we have the ability to actually get into that extension. So really simple exercise would just be a simple standing lunge, basically tilting the pelvis back, squeezing that glute, and you should feel really good pull in the front side of that hip. So
it's
obviously
this motion.
Yep, the
right
pelvic
here.
tilt, and then contracting the glute, and you should feel real good stretch in the front of the
Yep.
hip.
So you get that stretch right in there.
Exactly.
Yep.
So then
So if you sit a lot for a job and you want to start running, that will most certainly be tight, I would imagine.
Exactly. So the reason this is so important is because when you have good hip extension, it allows the glutes to actually fire. It allows you to get that full extension in your knee, and you can then push off more with your calves. Versus if you're just kind of going through this little range of motion, you're kind of just shuffling along versus getting that full natural stride.
Right.
Yep. And then the other component is the stability side of things. So not just having the mobility in the hips, but the actual stability. If you think about running, it's basically jumping from one leg to the other thousands of times. And what we see a lot of is people don't have the good lateral hip stability, so their hips kind of drop, or they twist, or they just can't develop enough force out of the glutes to propel them forward. So a really simple exercise.
So people who have that, say they're starting to run, will they feel that, or will they feel weakness, or is it one of those things that you're really not aware of?
You're usually not aware of it, and it's one of those, like, once you actually get them strengthened and stable and you actually can use your glutes, it feels so much easier.
Sure.
But what usually happens is other parts start to compensate, meaning you might feel it in your knees, you might feel a little bit more soreness kind of in the lower shins because the muscles higher up the chain aren't doing their job.
Right.
So a really simple exercise that I like is just working on some single leg balance, but getting into a little bit of that single leg squat position. So you're really working those lateral hip stabilizers. And the other component of that is then getting into a little bit of hip extension on the other side to kind of simulate that running motion.
Can you turn profile so they can see
Yep.
that?
So
now, if you're doing this at home, you might need something to hold on
Yep.
to, the cupboard, furniture.
Little bit of
whatever.
balance assist. So basically making sure that the knee isn't going over the toes. You're not letting the knee collapse in either. You're just kind of sitting back. Think about hinging back like you're sitting back into a chair. So really loading up that glute muscle, and then just a nice, easy side motion. Kind of throw your balance off a little bit, but you should really feel good activation there in the back side of the hip. So this is one of my favorite kind of beginner exercises, just so people know what it feels like to activate the glute muscle.
So they might want to do that 10 reps on a side,
Yep,
20.
something simple, 20 reps, pre-run, just to get things firing and active.
Sure. So we're talking about the glute maximus or the
A little bit of,
abductor
yeah, a
loop?
little bit of both
Sure.
actually. The glute med, glute max, because you're kind of getting into that extended position, but you also have to stabilize the lateral hip
Right.
so you're not just dropping down.
I think the basics of whatever you're doing, hips and the center of gravity is so critical. When I first started running 25 years ago, I just thought my leg muscles.
Yeah,
I didn't
yes.
think about core.
Exactly.
I never did core exercises, and I thought, what do I need core exercise? Now
The core is the foundation of it all, right? A lot of
Right.
people just want to strengthen their quads or the hamstrings, but the stronger you can get your core and your glutes, it just makes everything else down the chain work
Right,
that much
right.
more efficiently.
Good. So, Jake, now if someone they're a beginner runner and they say, well, maybe they could use your services. Is that something that's available and it doesn't matter where they live?
Yeah. Well, like I said, we work with people all over the U.S., so it's all done remotely. We have a program that we use for the actual running prescription, telling them to go, run X amount of miles or walk X amount of duration, the mobility, strengthening routines, and then obviously the communication side of things through email, phone calls.
So typically someone might do an evaluation with you the first time visit.
Yep.
And then do you see them once a week or twice a week?
It's kind of unlimited in terms of just, the more questions you ask, because, right, as PTs, we have all of this knowledge that we can, give people, but we have to take into context their current situation, their previous
Sure.
experience, and their goals,
Right.
right?
So it's specific to their needs.
Exactly.
It's efficient, so they don't need to see you 100 times.
Exactly.
Yeah.
The whole goal is to keep people out of the PT clinic, right?
Right.
It's like we want to make sure you're having fun, staying healthy, but also able to reach your goals and not get hurt. I mean, that's how the whole coaching side of things in our world came
Right.
to be. So,
And I think reaching back to that initial evaluation with Bob, where, he had already been running, knee hurts. The MRI said torn meniscus. The doctor said in a conservative way, which most doctors will, you're 60 years old, you're going to run half marathons.
yep.
Doesn't make any sense. And so you can't run anymore. And Bob's like, but it doesn't hurt. I can still run. And, and I knew him. It's like, I wasn't going to tell him to go run because
Yes.
not in the store where he works. He's a Ace Hardware owner.
Yep.
That's how I got to know. But anyways, yeah, and I'm glad he got a hold of you, and he's very happy because he loves
Yes.
running.
Yep. And he is a hard worker too.
Yeah.
Yeah. It's been
There's
quite
no doubt.
successful.
All right, very good. Beginner runners, this is excellent exercise. This is just like, I wish I would have been knowing someone like you 25 years ago when I started running instead of running without shoes that don't have any
Yep.
whatever. Good. Jake Hegge,
Awesome.
thank you very much.
Thanks for
And,
having me.
Dr. Jake Hegge, I have to apologize.
Thank you.
Address
Thank
you
you.
properly. Have a good day and run on.